All right. Well, good morning, everyone. It's another fantastic Monday morning here at Healthline Markets. And thank you for being on this call because we have one mission here, and that is to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. Thank you for being on this call. This is the last call before AEP officially ends for 2024. But over the last week here on Friday, actually Thursday was the last day, we ended our selling season for 2023. So we're going to talk about that this morning, just very quickly. We also have a special guest from our friends at Aegis that we'll have on the line that's going to talk more about all the up and coming good news that's happening there at Aegis. But in the meantime, remember, guys, we got to keep one foot in the classroom and the other one in the field at all times, including during AEP. There are quite a few things happening here, and we want to ensure that you have the information to close out the year strong. There is still selling time after Thursday. So Thursday is December 7th. It's the last day to use the AEP designation to enroll folks. But we're going to be setting up some trainings for SEP because you have a hurricane SEP still, and we're going to talk about that this morning. You have five-star plans, you have chronic conditions, you have DSNPs, you have people in institutional care, you have move-ins, you have agents, you have T65s. There's so much going on in our community. As long as you're engaged, you're going to get those opportunities. So we're going to talk more about that and to ensure that you're maximizing your potential because 2024 is going to be fantastic for you. I can feel it. I can feel it. All right. So with that, we have to keep one foot in the classroom and the other one in the field. Let's go ahead and jump in to the trainings this week. There's not a lot going on, but I do want to share with you a couple of special events here. This morning at 11 o'clock, United Healthcare is hosting the VA and TRICARE for Life training to help our veterans, and there's a lot of confusion around, do I enroll people with TRICARE? Can I enroll people with TRICARE? What about VA? What are the different levels of VA? Who qualifies? What kind of plan should they be on? These are all great questions when you run into our military folks. And so United Healthcare is hosting that training today at 11. It's a really good one if you haven't been to a VA TRICARE training. They do an excellent job with that. So please go ahead and jump over to that today at 11. Again, if you don't have the training calendar here, just shoot us an email at support@askhpm.com and we can get that calendar synced to your phone, laptop, or iPad. So that way you have the calendar here. Anytime it's updated, you automatically get all the trainings right on your device. So we can make that happen for you. Moving over to tomorrow, United Healthcare is doing an over-the-counter training. The healthy foods and utilities cards are all really, really hot items. And this is pretty much across the board, but United's going to dive deep into how they operate as a company there for that. Wednesday, we've got our very own Al Clancy for a virtual coffee and chat session. You can jump on that at 9:30 on Wednesday. Mark your calendar because he's got some great information on how to close your AEP strong. What opportunities do you still have in December to close out one-ones of strong for Medicare? And we're going to talk about ACA here this morning too, because I know a lot of you are not taking advantage of the opportunities with ACA specifically. But Al is there as your go-to guy. If you have any questions, concerns, or you need a little bit of help with training, he's your guy Wednesday at 9:30. Also on Wednesday, Cigna's doing their virtual office trainings or their office session. So those of you that are new to Cigna, Medicare, or have any questions about that product, you can jump on at 11 on Wednesday. Nothing on Thursday, but Friday, we've got our very own Tom Ryan hosting What About HPM Shop? This is our Medicare quote and enroll tool. Those of you that have been using it, thank you, thank you, thank you. We really appreciate you using the software. We've invested in it for you, so we appreciate you using it. And I do know that those of you that have been using it are gaining points on the contest for AEP. We've got some new winners, so we're going to talk about that this morning as well. But I really appreciate everyone using Shop. If you're new to it, or if you have questions, or you run into any errors, Tom's always available 9 o'clock on Friday, and he can go through it with you to make sure that you understand and know how to use the incredible software system that we have for that. And Friday, training of the week. I am hosting myself ACA training for 2024. I couldn't do it during the year because it just got a little bit too crazy for me. But those of you that are exploring the ACA market, I'm going to start from the very top to bottom for ACA training. So I'm hosting two of the same trainings. They're the exact same trainings. I'm just hosting them at different times. You can join at either 1 o'clock or we're going to have a 3 o'clock session on Friday. And I'm going to be deep diving with ACA. You know, we're going to talk money. We're going to talk bonuses. We're going to talk opportunities. We're going to talk how to prospect for leads. We're going to talk about all that good stuff on Friday. So either 1 o'clock session or the 3 o'clock session there. And I have the link here if you want to go ahead and sign up right now. I'm going to put it in the chat. You should be able to click that and it'll take you to where you need to go. Let me just double check, make sure that that worked. Okay. Yeah, either one of those links works. And that should take you to the registration page so you can register there. So make sure you register so that way we can get you into that training so you can start making some ACA money. That's how we do it. Okay. All right. So that's the training for the week. Remember, let's keep one foot in the classroom and the other one in the field at all times. There's this ACA training. You should reach this landing page here. And again, you
Okay.
either one. Somebody unmuted themselves. So you can select 1 or 3 o'clock there, and then just put in your name, last name, email, and phone number. And if you'd like to subscribe to additional webinars that we're going to be hosting throughout the year, you can go ahead and click auto subscribe and then click save my seat. And we'll send you the reminders and all that for Friday. It is being recorded. If you have to jump off for an appointment, we get it. But you can go ahead and subscribe there and we'll always send you a replay. Do that. Okay. All right. Let's jump over. Well, before I do that, I do want to make you guys aware that we have been having a few issues with our emails. So Jonathan's looking into the email system right now. So if you haven't been getting emails, we're aware of the issue. You should be able to send us emails to support@askhpm.com. Please make sure you do that. So again, I'm going to put that in the chat, support@askhpm.com, or give us a call, 844-696-3975. You guys should have that by now. Lock that in, and you can call us or email us there. We're just having issues with sending emails out from our system with notifications. So we're working through that issue as we go forward, but just want to make sure that you're aware of that. As I mentioned earlier, the end of the year has come and gone. So the last day to sell a product for 2023 was Thursday. Okay, that was November 30th. And as of Friday, you should be writing nothing but 2024. What does that mean? If you have any marketing materials, any books, any products, any flyers, any brochures, anything that's related to 2023 benefits, you must dispose of it. Get rid of it, have a bonfire, create a paper mache balloon. I don't care, but you should not have it anywhere near your selling areas, okay? Go through your garage, go through the trunk of your car, go through your home office, get rid of anything 2023 or even, even back. We found stuff 2022, get rid of it all, okay? 2024, you should only have 2024 materials in your possession. That includes the booklets, the summary of benefits, evidence of coverages, flyers, brochures, cards, business cards, anything at all that has 2023, you got to get rid of it. You should only have 2024 in your possession, okay? I cannot stress this enough. I have seen agents accidentally pull out a 2020 or, a previous year application and fill it out. It will be rejected. I've also seen agents pull out and leave booklets from the year prior. That is a no-no. That is very bad. Let's not do that. I understand you guys have marketing flyers out there in your community, your doctor's offices, your pharmacies, anywhere where you've placed, your drops. You're going to have to go back out there and replace them with 2024. Okay, so think about that. Where are your marketing sites? Where do you leave flyers? In fact, if you don't remember where you leave flyers, might be a good idea to create like a spreadsheet or a note somewhere to say, hey, I dropped flyers at this laundromat. I dropped them at the doctor's offices. Here's the doctor's addresses. I dropped them at the Walmarts. I dropped them at the pharmacy. So wherever your marketing flyers are, you've got to recanvas everywhere you've been and collect anything that has 2023 on it. Now, if you're using generic flyers, you're good. You don't have to worry about that. I could tell you that we've seen that happen where the generic flyers are out there, and that's fine. As long as it doesn't have any benefits on it specifically, you should be good to go. We do have generic flyers. If you want to just switch gears and use those, please send us an email at support@askhpm.com, and we'll go from there on that. Okay. We've got some the deadline here. We're going to talk about SEPs. In fact, I just saw a chat pop up. I'm going to talk about that in a minute. So we have SEPs happening for Medicare and ACA as well. We're still in ACA open enrollment until January 15th. So you go business as normal, and we'll talk about SEPs later down the road. But for Medicare specifically, we want to ensure that you guys are aware of these SEPs. Again, you can still write from December 8th until December 31st, and you can write for 1/1s. So that'll help your contest, right? So remember what we talked about at the beginning of the call. There's still a lot of opportunities out there to write business. So the official deadline is December 31st for us, and I see a lot of applications happening between December 8th and the 31st. I understand we're going to get into the holidays and all that, but don't give up on your goals, don't give up on your dreams, because you still have 3 weeks to sell in December, and use your time wisely during that time. Okay, so let's jump over to the contest because I want to make sure that you guys are tracking that as well. So the contest will continue to roll all the way until December 31st. So you can continue to write 1/1s and get on the board here. So as a reminder, the contest is here. You can watch the video. We've got the self-reporting app here for Ultimate, UHC, iSnip, and the Baycare apps, the flyers here. And then the contest board was actually updated as of Friday. So thank you, John, for taking care of that. We've got some new people that have broke 60 points. Congratulations to you guys that have entered into the cruise, but just keep in mind that you may have cancellations, chargebacks, plan switches that do not count. So I recommend getting into the 70s or even the 80s for the points there as well, just so you have a little bit of a buffer. But if you're sitting at about 60 points, just add to it. Those of you that are in the 50s, you got a fighting chance here. Even in the 40s, you got a fighting chance. You got 3 weeks to sell. I've seen some amazing things happen between December 8th and December 31st. So keep that rolling, guys. So there's a contest. 2 more things before I hand it over to Aegis. They're going to come in and talk to us about their great stuff. I do want to make you guys aware of the enrollment consent form that is required by the marketplace. So if you have a new client or an existing client that's switching their plan, you do have to have this consent form completed. It's kind of like in the Medicare world, it's kind of like a mix between the scope of appointment and the consent to contact form. Basically, it's just confirming that the member understands that they're either changing their plan, their information, and you're going to be helping them. So it gives them permission, gives you permission to help them with their plan. And it's also consent to go ahead and talk to them about their benefits as well. So I have this available. If you need a copy of this, it's in the gold key, but you can go ahead and shoot us an email at support@askhpm.com. Okay, but I do want to make sure that you guys are collecting those. You can actually upload them directly into Health Sherpa now, which is a fantastic option for you as well. Lastly is SEPs, and I know that I saw a chat there, but we did get notice from Health First, who is an up-and-coming plan in the Florida market. Health First is recognizing the Hurricane Idalia up until December 31st. So if you're in the markets that Health First is selling in, they're accepting that SEP all the way into the end of the year. So we saw that in the email that they sent out earlier this year, or last week, I'm sorry. So there it is. Also, I see in the chat, I see Aetna has an SEP due to impact of war in Israel ends 2/29. Do we have an efficient way to check all the other carriers to see if they are honoring this SEP as well. We will receive notices by the carriers saying that they'll accept certain SEPs. It's a great question. Not every carrier accepts every SEP. It is based on the carrier. So like I said, I'm noticing these in the emails, so just pay attention to your email, and you should be able to get in there and know which SEPs are available. We also have a spot on the Gold Key. If you're not familiar, shoot us an email at support@askhpm.com, and we're going to be tracking them there as well. Okay, so whew, that was a lot. I do appreciate everyone's time here. So I do have a special guest on the line from Aegis, I hope. Can you hear us?
Yes, good morning.
Good morning. How you doing?
I'm fantastic. How about you?
Very good. Thanks for joining us, Mary.
Nice having them. I'm so happy to be here today. I don't have my best voice today, but I'm gonna try.
Oh, okay. Well, we appreciate it, and I'll fill in where you need a break, okay?
Okay, so let me see. Can I share my screen? Let me see.
Yes, you should be able to. Let me see if I can
Let me
get
see.
you
Yes.
moderator there. That should pop up. There you go.
Okay.
Perfect.
Okay, so I'm going to talk a little bit about Aegis Medical Group. My name is Mary Santiago. I'm the new marketing manager for Aegis. I have been here for almost 3 years now. I was a marketing liaison for 2 years and a half, and now I'm the manager. You may remember Mr. Brian Clemens. He was the marketing director, and he's no longer with us. Now our director name is Ingrid Negron. So she is in another meeting right now. So we are just going through what we do at Aegis, how we can collaborate. And if you have any questions, I'm going to pop up my contact information in the chat. Okay. Okay, so this is our organization. A lot of people ask us, what is Aegis, where you guys are located? So we are an MSO and we are part of Lakeview Healthcare Enterprises. We have 12 plans. We are in 15 counties in Florida, and now we are in New York, in the Bronx. We have over 90 locations and over 130 providers, including mid-levels.
And I understand sometimes that does happen. And,
Oh, sorry.
take it out.
Hold on.
Just don't bring it.
Yeah.
Go ahead.
It happens,
Gotcha.
I know. And that's divided between Aegis Medical Group, Lakeview Healthcare Systems, and our affiliates. So this is a map, so you can see where we are located. The bulk of our business is Lake, Marion, Sumter, and Orange, but we have affiliates all the way up to Jacksonville and all the way down to Port St. Lucie. These are the plans we accept. We have 12 plans, and at the Aegis locations and the Lakeview locations, we accept all of them, and the affiliates, it depends on the contract. Services, same as the plans. The services depends on the locations, but you will find most of these services at the Aegis locations and at Lakeview Healthcare Systems. So we offer transportation, same-day appointments. This is very important for the brokers. If you need help with a patient, that's what we are here for. You need to set up an appointment. They need to be seen right away. At the Aegis locations and at the Lakeview offices, they will be able to go and have like same-day appointments. We have a system with 24-hour access to the physicians. That's through their cell phone. Our doctors give their cell phone numbers to their patients, and that's something that makes us differ from the rest. We have urgent care hours in Lake, Marion, and Sumter. We have an urgent care facility up there. We have in-house lab capabilities, pharmacy management, chronic care management, infusions in-house, etc. So you will find like one-stop shop in most of our locations, especially the wholly owned clinics. We also have a specialty building in Leesburg. We have dermatologists, interventional pain management doctor, physical medicine, rheumatologist, cardiologist, all that. You can find all the doctors and their bios on the Lakeview Healthcare System website, which is lvhcs.com. You can also see their names and their photos in the Aegis website. how we can collaborate and work together. So we do all of the things. So there's no crazy ideas. We do events at the clinics. We do meet and greets, open houses, events with the patients. If you have any idea that you think works for you, we can collaborate and do that. We attend seminars, health fairs, community events. We do laundry with the patients, casino nights. If they love to
Mm.
do something at one of the communities and they want us to do that, we just Google it and we just make it happen. Partnerships, we collaborate with the plans. We don't put like a dollar number on our patients. What we do is that if you want to collaborate to do something for the patients, we are there for you. We can pay for the events. We bring the food. We bring the gifts for the patients, giveaways. We can partner to do a health fair. So we are here to collaborate with you to make that patient experience like the best. We also do community services. If you know any food drives or if you create fresh market events, let us know. We will be more than happy to support those events as well. We met a lot of you at the broker rollouts. We are only 3 marketing reps for the entire
Mm.
organization, and we went to almost all of the events
Mm.
all over. Advertisements, we also collaborate to do newspaper ads, magazines. We are right now in a radio campaign. If there's any opportunities out there that you want us to collaborate with you to help your business and then collaborate, we will take care of your patients and we can just put that money in there as well. We create everything in-house, the mailers, all the posters, flyers is usually faster through us. You let us know if we have an event together, we can create the flyer the same day, or maybe in 2 or 3 days, we will have that flyer out. And
Mm.
like I said at the beginning, there's no crazy ideas. You let us know what you like to do with your patients, and we will make it happen for you. We just started a new broker portal. We should have a new website, a whole complete new website in next year by March. But right now we have a broker portal. You can go to aegismedicalgroup.com and you will see the physician directory in PDF, and you will have our contacts in there. And you will also have this form where you can just register your members. Usually we ask the members who referred them to the clinic, and we put it on the system. But this is also helpful for us to know how many patients you are placing in the clinic. If you need help setting up an appointment, any of that, feel free to fill out that form. And that will be it. If you have any questions, I'm here for you. I'm going to put my information in the chat. My
Mhm.
name is Mary Santiago. Ingrid Negron is our marketing director. She is also the director of provider relations. Dee Teasdale is on the west side of Florida, and then we have Wilfredo in central and the northeast. Thank you so much for
Mary,
the opportunity.
no,
Yes.
that's perfect, Mary. Awesome. I'd like to talk to you about the marketing opportunities because, this is very unique that, you're allowing the agents to participate or collaborate, as you were saying, and you don't really put a dollar amount on it, which is very stressful for an agent to track that because, you might have 10 people show up and then you have a lead, but the lead doesn't sell for like 3 to 6 months. It does happen.
Mhm.
So we sometimes get partners that are I don't want to say upset, but frustrated that hey, we haven't gotten sales from this event, but there's a lot of leads there. So
Yeah.
so you're out there, you're seeing what's going on. What would you recommend for the agents on the call right now as far as activity between now and the end of the year, kind of knowing that Christmas is here, you got Hanukkah in the mix too, and some other holidays as well. So, what are your thoughts? What do you think is going to work during this time right now?
I think that the most important part right now is to nurture those relationships. We are in this season where everybody thinks that they are a number for the doctor. They are a number just for the brokers. So nurture those relationships, make them feel special. If you have any events, for example, we are working right now on doing some giveaways for close to Christmas, like
Hmm.
in the middle of December. If you follow up with your members, let them know that you're there for them. It doesn't matter if they sign up or not. And that is very important for us. A lot of patients and prospects that come to the clinic, they say that they like that we don't pressure them to fill any paperwork to sign up right away, and they just come back. People will remember how you made them feel. They may forget what you said. So
I love
I
that.
think that it's a relationship business. We are here for the long run, and we
Mhm.
love to. Everybody says, yeah, we treat our patients well. We will make sure that your patients are like receive the treatment they deserve.
Mhm.
However, a lot of people don't put that in practice. I think that
Mhm.
making your patients feel special, that makes the difference.
I agree. I agree. You say the same thing I do. You know, people don't remember what you say, but they remember how you
Oh, yeah.
feel, how you
Mhm.
made them feel. It's amazing. I noticed you guys have been really busy. The growth is fantastic. Even in New York, that's new. What I was curious about is your specialty location. How does that work between all of your doctors? And let's say we bring a new patient to Aegis and we put them with one of your primary care doctors. How does that multi-specialty facility kind of work between all of your doctors? Because it seems like it's just one location. Is that right?
Yes, it's
Okay.
in Leesburg. So most
Mhm.
of the doctors that use that location are in Lake Marion, Sumter areas, but anybody in our network can use that location as well. So when we
Okay.
have a new provider, we take them in a tour. They go and meet all the specialists, and we also have a preferred provider network. So even though we don't have the specialty building is not close to that patient, we may have another provider that can help them, that is a specialist as well.
Okay. Gotcha. So you kind of have a network, within your organization that you guys trust specialists out in the community that you would prefer to work with just because of, the relationship that's there and for efficiency. Is that right?
Yes. Depending
Okay.
on the location, if you have a patient that had like a special need and they need to see a specialist in the area, let us know and we can find somebody for them.
Fantastic. Fantastic. Yeah. If you could share your contact information in the chat, that would be fantastic. Mary, thank you very much for your time today. We look forward to meeting Ingrid and definitely more of your team. We'll put something together. Please coordinate
Yes.
with Nick, and we'll do like a happy hour or something like that where we get to meet
Yes, we need it
all of you
after
guys. Oh
after
yes,
this busy
definitely.
season. Let's do something together. We love to have fun. Like we work a lot. We drive all
Yeah.
over
Yeah.
the estate, but we love to have fun with our brokers. Like we really we want to thank the brokers, because if it's not because of you guys, we will not be able
Mm.
to do this. Like the brokers are our eyes and hands. Wherever we go, sometimes they are like, Mary, I have this location. Can you please bring the food? I will set up everything. I just show up, pay for everything, and then put my face in there and the name of the company. So
Wow.
thank you so much for that.
That's amazing. Thank you, Mary. We really appreciate your time today. And guys, if you have any questions for Mary, she's put her phone number in there and her email in the chat. And for those of you that might be on just your cell phone, it's msantiago at
Mhm.
aegismedicalgroup.com. Again, if you
Yes.
need to reach out to Mary, you can always reach out to one of our team members here at HPM and we'll connect you as well. But Mary, thank you very much for your time this morning. We really appreciate it.
Thanks for the opportunity. You guys have an
You
amazing
got it.
day, and I hope you have like lots of applications in this AEP season.
Absolutely, absolutely.
Yes,
All right, everyone. It is the last week of AEP. You've got today, tomorrow, Wednesday, and Thursday is the last day to submit applications. So please make sure that you get your apps in. This is the time that you want to follow up with your leads and get everybody closed. Okay, we are at the home stretch, but don't forget that as of Friday, December 8th, there's still opportunities, as you heard from Mary. There's still activity to be done, and there's still room to grow. So if you need anything, please reach out to us. You know how to get us. I hope everyone has a fantastic and productive last week of AEP. Good luck, everyone.